Module Overview. Medical professionals operate in high-pressure environments where accuracy, speed, and clarity are essential. To save time and space, particularly in documentation, prescriptions, patient charts, diagnostic reports, and communication, abbreviations, acronyms, and symbols are used extensively across all healthcare settings globally. However, incorrect use or misunderstanding of these terms can result in medical errors, miscommunication, and poor patient outcomes. This module provides a comprehensive introduction and in-depth exploration of the most widely used and internationally accepted medical abbreviations and symbols. It also explores how regional variations, UK, EU, Canada, influence abbreviation standards, the risks associated with their misuse, and how to interpret them safely and correctly in practice. First, definition and scope. Abbreviation, a shortened form of a word or phrase. Example, BP equals blood pressure. Acronym, an abbreviation formed from the initial letters of other words and pronounced as a word. Example, AIDS equals acquired immunodeficiency syndrome. Symbol, a graphic character representing a medical function or concept. Example, increase, decrease, prescription. Second, importance of medical abbreviations. Efficiency in documentation, speeds up charting and reporting, space saving in medical records, enhances interdisciplinary communication among doctors, nurses, pharmacists, lab techs, reduces redundancy in healthcare language, helps maintain confidentiality in quick notes. Third, categories of abbreviations. A, vital signs and measurements abbreviation, meaning BP blood pressure, H, R heart rate R, respiratory rate, TPR temperature, pulse, respiration, O2, stat oxygen saturation. B, time and frequency notations, abbreviation, meaning QD, once daily bid, twice daily TID, 3 times daily KID, 4 times daily PRN as needed stat immediately. C, diagnostic and lab terms abbreviation, meaning CB, C complete blood count, U, a urinalysis, C, XR, chest X-ray, MRI, magnetic resonance imaging, ECG/EKG, electrocardiogram. D, route of administration abbreviation, meaning PO by mouth, IV, intravenous, IM, intramuscular, SC/SQ, subcutaneous, PR, per rectum. E, common conditions abbreviation, meaning DM, diabetes mellitus, HTN, hypertension. COPD, chronic obstructive pulmonary disease. CHF, congestive heart failure, UTI, urinary tract infection. Fourth, symbols and their clinical significance. Symbol meaning, increase/rise, decrease/fall arrow, progressing to X times, e.g., 3x daily, number degree. Fifth, avoiding dangerous abbreviation errors. Many abbreviations have been blacklisted by safety organizations like ISMP, Institute for Safe Medication Practices, NHS Improvement, Health Canada's Safer Healthcare. Now unsafe examples include U for units, mistaken as 0, 0, or 4, 4, IU for international units, mistaken as IV or 10, QD, daily, misread as QID, 4 times daily. Solution, follow institutional policies, use tall man lettering, e.g., dobutamine versus DOPAMINE use. Approved lists of safe abbreviations. Sixth, global differences in use. UK NHS prefers full word notation in electronic records to avoid ambiguity. Canadian health systems follow ISMP Canada guidelines for abbreviation safety. EU hospitals often follow country-specific protocols, but generally align with World Health Organization and European Medicines Agency safety frameworks. Seventh, abbreviation use in digital records. With the rise of electronic health records, EHRS, abbreviation use is controlled via drop-down menus, smart text, autocorrect audit trails. EHR systems like Epic, Cerner, Meditech have built-in controls for abbreviation safety.